Bonjour, mes amis. It is wonderful to have you here with us this evening, where we are going to be exploring inflammation as a hidden driver of disease, as a hidden driver of aging. And we're going to be digging really deeply into it, kind of cutting beyond the fad that inflammation to a degree is, to truly what is it, and how is it influencing not only your day-to-day, but your ability to carry yourself healthfully and happily into the future. To have this conversation with me is Dr. Richard Horowitz. He's back by very popular demand. He is a two-time best-selling author. He's a board-certified internist, and he is the medical director of the Hudson Valley Healing Arts Center. He's treated more than 13,000 people with Lyme and or tick-borne disease over the past 40 years. His best-selling books are How Can I Get Better and Why Can't I Get Better? I like that naming. I like that parallelism. You can subscribe to more of his work at his Medical Detective Substack, or you can join his Lyme-based newsletter for regular insights, tips, and advice at cangetbetter.com. Dr. Horowitz, welcome back. It's wonderful to share the stage again with you.
Yeah, good to see you again, Krista. Thank you for inviting me.
Yeah. Now, audience, for awareness, typically our conversations tend to go around the 90-minute side. As stars would have it, today we're going to be going about 60 minutes. So we probably won't have the typical amount for our questions and answers as we usually do, but I would really, really encourage you to continue to put them in. Dr. Horowitz and I are going to be recording a podcast later. It's going to be a much longer form that's going to dive much more deeply into some of the science, and we'd love to know, especially based on questions, what you're curious of hearing about. So even if we don't get it today, in the future, in that podcast, we will be exploring it, so it will not go neglected. All right, Dr. Horowitz, let's jump in. I want to start first by setting the stage, if that's okay with you, because I think in good and bad ways right now, inflammation is really popular. Everyone's talking about it, everyone has it. And when you ask the question of, well, what exactly is it? And how do you know you have it? People say, because I do. So I wonder if you can offer a working definition of what exactly inflammation is, and does everyone have it?
So, inflammation is essentially a fire in your body. I mean, there's things like acute inflammation. You sprain your ankle, and what does the doctor tell you? It's RICE. It's rest, ice, compression, elevation. You have pain, you have redness, you have swelling, right? You have heat, the cardinal signs of inflammation. What we're going to talk about today is mostly going to be chronic inflammation, which underlies all the chronic diseases that pretty much you could mention. And I was telling Krista just earlier, even to my surprise, because I've been a board certified internist for 41 years, I did a deep dive into the medical literature this year, looking at all the major chronic diseases that are affecting humanity. The A's, autism, Alzheimer's, ADHD, allergies and asthma, the B's for Borrelia, Babesia, Bart, C's for cancer, cardiovascular disease, chronic fatigue syndrome, digestive illness. Every illness I looked at had inflammation underlying it. And what was fascinating is all 16 points on the MSIDS model that I've been using for chronic Lyme shows up in every one of these illnesses. So it's kind of like a new model for me. I mean, I've been doing this for over 40 years, but what actually surprised me in the research is that, I knew Alzheimer's, for example, there are bacterial infections from your gums with Porphyromonas gingivalis or herpes viruses. Even Lyme has been associated with it. But I don't think most people know that inflammation, for example, pesticides and mold can also do it. Or you can get leaky gut with food sensitivities where food allergens get across the intestinal barrier. With lipopolysaccharide, which causes inflammation. It makes your blood-brain barrier leaky, and then you get brain inflammation. The inflammation is basically coming from a lot of sources. So because it's going to determine both your acute and chronic health, it's absolutely essential we find out where the inflammation is coming from and how it affects you individually.
Yeah. Okay. So I wonder again if you can ground us a little bit from your clinical experience. How do you usually see people showing up with this chronic inflammation? I know your practice is a little bit biased towards Lyme, but talk to me about what that clinical picture truly does look like. How are people showing up where you're like, ooh, you got some inflammation there?
Well, so, I think most people know this, but for example, when someone comes in and says, I have a chronic fatiguing illness,
Mhm.
I've been diagnosed with chronic fatigue syndrome, myalgic encephalomyelitis, or fibromyalgia. That is an inflammatory illness. And whether that inflammation is coming from reactivated viruses like herpes virus 6 or from Lyme. And in fibromyalgia, for example, they're finding up to 90% of the people have mold toxins, right? So when we do real-time lab testing from Texas, this is one of the chat questions I saw earlier before we started, we're finding mold toxins in 90% of our patients. And I don't think people realize, even in the fibro literature, this is like a major place where some of the inflammation is coming from. So if you have fatigue, if you have joint pain, if you have muscle pain, if you have nerve pain, tingling, numbness, burning, stabbing, headaches, memory, concentration problems, sleep disorders, psychiatric issues. A great example, just last week, I presented at the IMMH conference in San Diego, and I showed them how all the psychiatric major diseases, major depression, anxiety, generalized anxiety, psychosis, obsessive compulsive disorder, inflammation underlied all the psychiatric diseases and all 16 MSIDS factors was responsible. So, and of course, with genetics that we're going to talk about today, because it determines obviously how you manifest with it. But the point being is that inflammation is underlying any illness you can tell me, any disease manifestation you can tell me, inflammation is going to underlie it.
Yeah, that's hearing what you're saying, it's a very interesting paradigm shift. And I want to elevate, I think, two things that you've said. First thing you said, when people come in with fibromyalgia, and I remember even 10 years ago, there was debate whether fibro even existed, right? And there's a lot of doctors that kind of dismissed it as, you're just complaining. And now we're starting to see the shift of not only acknowledging its existence, but really digging down deeper to acknowledge its root cause and things that by and large are only starting to become into the awareness of the conventional clinics, right? That being mold, that being this very diffuse thing that is inflammation. Yeah.
Right. And even, I mean, it's now been elevated, ME, myalgic encephalomyelitis, fibro has really taken the center stage the last couple of years since COVID made its appearance, right? Because you're right, there was a lot of debate in the literature for a long time. Is it in people's heads? Are they just over exaggerating? It's like, nope. I've done the dive into the literature. It's all 16 factors.
Yeah.
And I think people, and long COVID, is turning up as one of those factors, whether it's the spike proteins that are in your vessels that are driving the inflammatory response, or it's Bartonella with the spike proteins that are driving it, or it's you still have thrombotic events. The point being, it's inflammation. And you have to find out where that inflammation is coming from.
Yeah, yeah. So I wonder if we could explore a little bit of your thought development, your awareness of this through your own practice, so that people can understand how, especially there can be a major event, be that Lyme, be that COVID, that can spark this inflammation that seems so uncontrollable, untenable, and spawns off into all parts of the body. So talk to me a little bit about your practice and how you started to confront this idea of inflammation and become so curious about it.
So, when we're dealing with inflammation in medicine, and there are markers of inflammation, which you can of course check, and many times they are positive. So you're dealing with ESR, sedimentation rates, right, is a classic one. CRP, C-reactive protein. It's an indirect marker of interleukin 6. It's a big inflammatory marker coming from a switch inside your nucleus called NF-kappa B. When it turns on, you get TNF alpha, IL-1, IL-6. We have high sensitivity CRP. In our practice, we'll check complement studies like C3A, C4A. C4A is high in Lyme disease and in mold toxicity. TGF beta 1 will be elevated in some of these people. VEGF, vascular endothelial growth factor. It's an inflammatory marker we see with long COVID, and we also see it with chronic Bartonella. I mean, you can get it with other things like cancer, but and then things like autoimmune markers, like even anti-nuclear antibodies, we see them all the time in our chronic Lyme population because there's something called molecular mimicry. Your immune system tries to go after the bacteria, and it looks at the flagella, the tail of Borrelia, and it goes, oh, I'm going to attack that, but it looks like your myelin sheath in some people. So they get anti-nuclear antibodies. They get rheumatoid factors that are positive, anti-myelin, anti-ganglioside antibodies, anti-thyroglobulin. We see huge amounts of autoimmune markers, and we now know that infections and toxins, a lot of environmental toxins are doing this, are driving a lot of this autoimmune reactions, as well as, again, the leaky gut and the food sensitivities and nutritional deficiencies, all the 16 points we'll talk about today. But the point being, almost every patient I'm seeing in the practice has these inflammatory markers of one form or another. And you have to determine, for example, with autoimmune markers, is it true autoimmune diseases? Like, is your ANA from somebody who has lupus? Well, do they have a double-stranded DNA or a Smith antigen? If not, it's a non-specific marker of inflammation. Rheumatoid factor is very common in the Lyme population, but it doesn't mean you have rheumatoid arthritis. You need a CCP, a cyclic citrulated peptide. So inflammation ultimately underlies everything we're seeing. And some of these markers, including functional medicine, I don't do a lot of it, but in your world, we can do lipid peroxides. It's a way to how much free radical oxidative stress you have against your cell membranes. We can check 8-hydroxydeguanine, how it's affecting DNA, protein carbonyls, how the oxidative stress is affecting the proteins. We have many ways that we can check inflammation. And again, we're finding it in most of our patients who are chronically ill.
Yeah. So again, just to underscore that idea that it's not in your head, we can take a sample of blood or, whatever tissue it might be and really say, we can poke at it and point at it and say, oh, here it is. It's not just a lived experience that people are trying to articulate to their doctor.
Yeah, no, absolutely. But I want to point out that not every patient who's got, a fire in their body, which is ultimately what inflammation is, will have these inflammatory markers. Sometimes they're negative initially. You treat the disease, all of a sudden they come out. So, they do change over time depending on the patient's status.
Yeah, yeah. So if I heard you, you started in the Lyme space in part out of necessity. That was the person coming to you. That was the person you were helping and supporting. And that then birthed this awareness of all these inflammatory drivers that in your instance were inspired by Lyme, but can be inspired by other things. Okay. So yeah, please.
Yeah. So, I mean, look, the thing is that the way I got into this with these other diseases is because Lyme is ultimately known as the great imitator, right? Just like syphilis was years ago. So a lot of these patients I saw came in with, they were told they had chronic fatigue syndrome, ME, or they were told they had fibromyalgia, or they were told they had an autoimmune illness, right? Or they were told it's in their head, right?
Yeah.
They're just depressed and they're anxious. And the doctors just never kind of dug deep enough to find out actually what was underlying the symptoms of their depression or their anxiety. And we now know that it's a combination of both genetics and all these inflammatory factors that ultimately, determine, as well as, of course, your life experiences, early on with early trauma, how these psychological factors manifest in your life.
Yeah. So would you say, I'm curious, now that you've done that literature review, you've spent a year looking at inflammation connected to different conditions. What are the ones that have surprised you most personally? Because I think it's not a far jump to go from Lyme to inflammation, right? What are the jumps where you were like, oh, I really wasn't expecting that? What are the jumps that most people, if you tell them, they're like, I'm not sure I believe this one.
So, I'll start with the A's. So if you start with, for example, ADD, ADHD, which is very common, right? Think about all these people coming in on stimulants. All 16 factors on the MSIDS map were underlying it. Autism, I probably would have expected many of these inflammatory markers, knowing what I know about, but again, all 16 showed up. It's the same thing with Alzheimer's, Parkinson's disease, Huntington's disease, all the neurological diseases, degenerative diseases we're seeing. But probably the ones that surprised me the most was cancer. All 16 factors were underlying cancer. I think most people think, oh, cancer, it's my genetics. Maybe it's my diet, how much environmental disrupting chemicals am I taking into my body, if you've kind of looked at that with plastics and everything else getting into you. But I think a lot of people with cancer think, oh, there's not much I can really do. They may not realize that there is bacteria, viruses, parasites, fungi, microbiome issues in your gut, mitochondrial dysfunction. All of these things affect cancer. So I'd say, that and probably even cardiovascular. As an internist, we learn, it's hypertension, high cholesterol, right? Your major risk factors. If you're homocysteine high, we look at those major risk factors. I would not have expected, even in cardiovascular disease, to find all these different 16 inflammatory factors on the MSIDS model underlying cardiovascular. So, and then as last week, as I, just told you, the mood disorders, when I looked at major depression and anxiety and OCD and psychosis, all 16 factors were underlying. Most people will say my mood, it's again, maybe it's genetics or, I had a bad experience with so and so, but you're not realizing it's a really complex interplay of these 16 factors with your genetics and of course your life, history of what you're experiencing that is actually telling you whether you're getting depressed or whether you're anxious or how depressed or anxious you are ultimately.
Yeah, yeah. In Interesting. I think to me it's very interesting that you haven't discovered anything new per se. You've just put a new filter and a new awareness around what already exists. And to me,
Correct.
that's very interesting. You've reinvented the wheel by not reinventing the wheel.
It's like pattern recognition, right?
Yeah, yeah.
It's just pattern recognition. It's saying like, chronic diseases at this point is, 85% of our healthcare costs, right? And 70% of our deaths. So, and yes, I'll go through the 16 factors in just a second. So, if we're looking at all these people with chronic, by the way, over 1 in 2 Americans in the US, I haven't looked at the Canadian statistics, but it's probably not far behind. Over 1 in 2 people in the US has a chronic illness. A certain percentage have two or more. It's affecting healthcare costs, disability, or quality of life. I mean, we need to do something about it because it's 18%, at least in the US, of our GDP. And, the new Secretary of Health, by the way, I've written to him and he wanted a one-page letter to look at like, how can we transform the healthcare system? So in this paradigm shift that you and I are talking about, I let him know that I have answers for Lyme disease. And I have a paradigm you may want to look at that could explain a lot of these chronic illnesses, including autism, that, he has spent a lot of time with looking at red dyes and other things. And that you may want to look at, what the science says, because there's other ways of approaching this. So you're right. It's not like the only thing new I discovered was dapsone combination therapy for chronic Lyme and figuring out actually, how to get this disease in remission. And in many cases, actually, it looks like cure it. My wife is 7 years in remission. Yeah, I mean, it's great at this point. But yes, I mean, it's just really looking at it from another perspective and saying we can do better. But anybody who's listening who says, yes, I have fatigue, I have pain, I have headaches. I did the search on migraines. All 16 points are underlying. No matter where I looked, I found the same thing. And most doctors will say, here's Imitrex for your migraine, or if they're functional medicine, they'll go, oh, here's some magnesium, here's some B vitamins, right? They'll look at other things. Here's CoQ10 because mitochondrial dysfunction underlies migraine headaches. But they may not look at whether you had Lyme underlying your migraine or leaky gut with food allergies or mast cell activation.
Yeah.
I think so. That's really, I think, the take home point is no matter what your symptom or the disease you're calling it, I'm going to advise you to go to this 16-point model. And that's my book that's coming out next year from Simon & Schuster. We don't even have a name yet. I'm submitting the manuscript, by the way, the end of this month. We'll figure it out. It was called, when we submitted it, Why We Stay Sick.
Oh, I like
So
that.
yeah, but it'll change 20 times before it's finally out. But for anyone who's suffering from fatigue, headaches, joint pain, muscle pain, neuropathy, memory, or a disease that your doctor has named, I'm letting you know from 1 year of doing this in great detail, you really want to take a look at these 16 factors. And I should describe them to you. You want me to do it now, or we can describe it later on so people know where to look?
No, please, because at some point I do want to transition into, so what do we do with all this? If we know inflammation is root cause, what can we do in advance? But I think it would be helpful to identify the 16 so that people have a bit more of a working awareness and something more tangible than, again, this diffuse definition of inflammation.
Yeah.
Yeah.
So the way I normally describe it is that in the 16-point model, there's 6 major factors that drive inflammation. I affectionately refer to them as the 6 rivers of inflammation, which go into an ocean of inflammation. So the first 6 factors are, number one, your infections. So that's A, bacterial, B, viral, C, fungal, and D, looking at what we say, viral, candida, fungal, and bacterial. Number 2 is environmental toxins. So environmental toxins in my world, I mean, there's literally hundreds to thousands you're exposed to daily, but we mostly focus on the easy ones we can check, like heavy metals and mold toxins. And most of our patients are showing up for these, whether it's lead, mercury, arsenic, cadmium, aluminum. And they have a lot of mineral deficiencies and vitamin deficiencies because they have to detox these chemicals, which is the third point, right, on these 6 points. The next two have to deal with your gut. One is actually having microbiome issues. I did a several part series on my medical detective Substack recently on the microbiome. In fact, number 5 is coming out tomorrow. Well, 4 or 5, and there's another one following. I go into this in great detail, and it turns out your microbiome is playing a massive effect on how much inflammation you have, depending on how much lactobacillus and how much bifidobacterium, if you have healthy bacteria in your gut or not, which produce short chain fatty acids that are anti-inflammatory. So the gut, and then leaky gut with food sensitivities and mast cell activation. So those are the 2 gut issues. And the 6th one is insomnia. Most of my Lyme patients don't fall asleep for hours and they keep waking up in the middle of the night. Insomnia is a big inflammatory driver. You get elevations in interleukin 6. So all of the patients pretty much, I'm not exaggerating, of these 13,000 plus, have all 6 factors. They have, Lyme, Borrelia, and Bartonella show up at the top as bacterial infections. Parasites like Babesia are right behind. We've seen a lot of viral reactivations ever since COVID came out with HHV6 and Epstein-Barr. And then with fungus, we're dealing in part with mold toxins, but also even Candida overgrowth in the gut, which causes reactive hypoglycemia symptoms. And it looks like Lyme with fatigue and brain fog and pain. Everyone's pretty much got mold. 90% are testing positive for mold through real-time labs in Texas on a urine mycotoxin test. And then again, we're finding leaky gut and the rest and the 10 downstream effects. So now you think about this, you've got this fire from these 6 major inflammatory factors, and they have downstream effects in your body. The first is the inflammation is affecting your brain and your hypothalamic pituitary axis. So all your hormones are going to get affected by this inflammation. Men come in with low testosterone. I was just writing up the story today for the book on this guy who came in with like a 100 testosterone level in his 30s. It should normally be 600 to 900 because he had inflammation in his brain. Women go into early menopause or have low estradiol, and 99.9% show up with low adrenal function. The stress of the illness is affecting them. And then we see things like POTS dysautonomia, postural orthostatic tachycardia syndrome. So the inflammation affects the part of your nervous system that controls your blood pressure and your heart rate, as well as your bowel and your bladder. So people stand up and they get dizzy and they feel like they're going to pass out, or they do pass out. They have resistant fatigue, anxiety, palpitations, and brain fog because the autonomic nervous system is affected from inflammation. Mitochondrial dysfunction, one of our favorite topics, because your DNA in your body has histones protecting it from this free radical oxidative stress, but the mitochondria don't have anything protecting it. So we see mitochondrial dysfunction pretty much in everyone. In fact, when I've done mitochondrial testing, it shows up literally in every patient we check. And then we see things like liver dysfunction, autoimmunity, too much immune stimulation or lack of immune functioning with chronic variable immune deficiency. We see deconditioning, psychiatric and neurological symptoms. So that's in essence what the 16-point model does. And again, to my surprise, it goes way beyond Lyme. It turned up in all these chronic diseases with all of these multiple, multi-system symptoms that people have. No matter what you're calling your disease, inflammation is there.
Yeah. So there's this idea that there's many pathways to get to the ocean between different infections, between the pathways that you've just outlined. And then once you're in the ocean, it's not like you are the entire ocean, you might be just part of it. And so it's almost as if different bodies will present with different parts of the ocean. So maybe some might be psychiatric, others might be MSK pain. So
Correct.
it depends on how the person almost funnels out and pops into that ocean. That is going to shift how that inflammation shows up in someone, which to
Right.
an extent explains why how the same thing can present very differently in different people. Is that what I'm hearing?
Yeah. So for example, somebody has Lyme disease, let's say, but they don't have Babesia Bartonella. They might be fatigued and have joint pain that moves around their body, migratory joint pain, muscle pain, and nerve pain, tingling, numbness, stabbing, burning, or vibration sense, classic hallmark symptom of Lyme, some brain fog. But then all of a sudden they get Bartonella. And now all of a sudden their psych symptoms are 4 times worse. They've got neuropsychiatric rage and psychosis and hallucinations from the Bartonella, which they weren't getting from the Lyme. They might have been somewhat depressed or anxious, but the BART just made everything go out of control. The BART also caused their POTS dysautonomia to be much worse. It caused a lot more autoimmune reactions. Their immune system wasn't functioning. So what we see is you add another infection and then put, Babesia parasite on top of it, and it sometimes gets worse. And then again, you add mold, which affects mitochondrial function and immune function. Well, then you can't fight the infections that you have because your immune system's not working correctly and the mold's overlapping your same symptoms. You're eating the wrong foods from your leaky gut. That's making the inflammation worse. So now you're fatigued and your brain fog and you get the idea. It's like and all of this is dependent, of course, on your genetics and your past life experiences. And that's why no two people, are ever the same when they present this way.
Yeah, and that also speaks to too often you see patients, they're like, one of the partners will come in and be riddled with all these things, and the other partner is a-okay. And it's that, they're living in the same house, they're more or less eating the same diet, but they have different histories and they have different genes. And that is really what is the magic sauce towards one person having it and the other not. Right. Yeah.
Yeah, and so for example, genetically in our practice, before the kind of sophisticated test that DNA company is doing with epigenetics and genetics, we would always check, for example, HLA-DR2 and DR4 in our patients because Alan Steer published, like 40 years ago, that if you have these genetic HLA markers and you take antibiotics for Lyme, your Herxheimer reactions, the inflammatory response when you're killing off the bacteria is going to be much worse, right? So those are things and we would see it. We would say to somebody who's HLA-DR2 or 4 positive, listen, I'm going to give you more glutathione, right, before I even start this protocol to start tamping down your immune response. And make sure you're taking, NAC, alpha lipoic acid, and glut to block that switch in your nucleus, NF-kappa B, because you're going to throw out this massive amount of chemokines and cytokines once I start treating the infection. Or we've got to give you more drainage remedies to get the cytokines out of your body, right? So it tells us like, okay, we know that this is going to be a rocky road with the genetics. We've got to prepare you for it. So, and that's the three major pathways, like NF-kappa B is number one. Number two, we always stimulate the NRF2 pathway. Oh, and by the way, what was also fascinating about writing this book is in the 16-point model that showed up in all these diseases, I discovered there were 16 major inflammatory pathways underlying the 16 MSIDS factors. I mean, that was a little bizarre. So number two, for example, is NRF2. So in this pathway, we use turmeric curcumin, we use broccoli seed extract, sulforaphane glucosinolate, resveratrol, and green tea because it opens up your detox pathways. These are like the most potent stimulators with broccoli seed extract to get your phase 2 detoxification enzymes working right well. We're tamping down the inflammation. It's also upregulating glutathione production. And then NLRP3 inflammasomes, the third of these 16 pathways underlying the 16 MSIDS factors, will do things like low-dose naltrexone to shut down brain inflammation because it's the microglial cells, these small immune cells in the brain, that turn on inflammation in a lot of these neurodegenerative diseases, whether you're talking autism, Alzheimer's, Parkinson's, it's all up those. So we use low-dose melatonin with LDN. So we're kind of looking at genetics, looking at the bugs you have, looking at the toxins going, we've got to get that inflammation under control or you're going to have a tough time getting through these protocols because the Herxheimer reactions are so severe.
Yeah. Yeah. I find it interesting and I like that within your practice, the space of genetics is almost in that preparation of how do we do what we're going to be doing better? Because that's very much my ethos when I think of when we interpret, especially a healthy person, when we take their genes and we interpret their genes, knowing this, how can we live in a way that continues that health, right? If we know the weak points, if we know what is going to rear its head at some point in time, how do we guard against that? So I wonder if that transitions our conversation a little bit, because I would imagine those that are on the call, they either are experiencing, they can already be like, of the 16, here are my 10, or maybe they're on the call and being like, uh-oh, maybe I have one or two, but I don't necessarily have this big full-flung presentation yet. Let's start having the conversation around how do we go about a prevention now that we know this, now that we know inflammation can feed into this ocean of disease. And now that we know we have to be mindful of the lifestyle, the environmental factors, the bacterial factors, et cetera, and the genetic factors. How do we stitch this all together so that people can kind of come out of this of, I know how to be guardful against inflammation?
So I'll give you a great example with COVID.
Yeah.
So we published in the medical literature. I was the first doctor to publish on glutathione in COVID. This was April 2020. This was literally right when yeah, I mean,
Oh,
I've actually gotten, I mean, I can't believe it with this one article. This one article has been quoted and referenced more than probably most of the Lyme articles I've done because we were the
wow.
first ones to discover it. And I didn't know it at the time, but the way I knew that we could protect our patients preventatively from this virus before we knew all the things that, it did, like microclots and everything that happens with it. I had patients come in with babesiosis who were short of breath. And I saw that, the COVID was causing bad pneumonias with, ARDS, adult respiratory distress syndrome, horrible difficulty breathing, people dying from it. And I said, gee, I remember these babesia patients coming in and I would give them a 2-gram shot of glutathione. And within minutes, their shortness of breath would go away, right? Because I was helping, I'm thinking I'm shutting down NF-kappa B and I'm detoxing the body from chemicals. So before we even knew that this was going to work, I told my entire practice, I sent them out a newsletter and I said, listen, and it's on my website. You can actually look at the original one. I left it up there. If you go to cangetbetter.com and you look under the COVID tab, you'll actually see the articles I published in 2020, and you'll see the recommendation I made in 2020, which, by the way, has not changed. It's exactly the same. Not one person died in my practice during COVID. Not one. We had all the patients taking N-acetylcysteine, 600 milligrams twice a day, alpha-lipoic acid, 600 milligrams twice a day, and glutathione, a minimum of 500 twice a day to block NF-kappa B. We had them take 500 milligrams of turmeric curcumin twice a day, up between 30 to 100 milligrams of broccoli seed extract, sulforaphane glucosinolate, with a milligram of melatonin at bedtime for NLRP3 inflammasomes, with or without LDN, with resveratrol, K2D3, because we knew vitamin D was going to be an important one with, regulating inflammation. Later on, we found out if your vitamin D levels were in the lowest level, right, you had more of a chance of having inflammation and dying from COVID, right? Even the CDC was telling us this early on. And I was using things like immune stimulants like beta glucan, immunotics from Zymogen, at least 500 to 1,000 milligrams a day to increase your natural killer cells that had to go after the viruses. So I told people, I want you to take this every day. This is going to be your prevention protocol. And if you get COVID, I then want you to up your glutathione to 2,000 milligrams 3 times per day, up your NAC. We only had 2 hospitalized patients the entire time during the pandemic. One of them was on IVIG and was immune suppressed, and the other one was on a respirator, but she had active babesia. And both of them made it out of the hospital and they were completely fine afterwards. And I think, because you were talking about prevention, like what do we do in advance? So if I was to take you into my kitchen, and I think my good friend Phyllis Freeman may be watching this tonight, and you were to see what I have on my kitchen counter of what I swallow every day, I'm literally, there's got to be, I'm not exaggerating this, there's got to be 70 supplements because every one of my family members has died of cancer. My mother died of lung cancer. My father had pancreatic and colon early on. My grandfather had it. All my aunts and uncles, whether it was multiple myeloma, they died of every different cancer imaginable. Now, with my genetics, Ashkenazi Jew, even though I've studied with Buddhist lamas for the last 42 years, my genetics are my genetics. So, I'm prone to these type of things, but they also were smokers living in Brooklyn with environmental chemicals. I basically am taking these things every day and I'm doing a science experiment. I joke with people that when I finally pass from this planet, you should biopsy me and look to see whether I died from all the supplements I was taking or I made it to 100 or 108. And it was actually because I think, after I looked at the 16 points and I went, all right, I'm going to exercise daily for HIIT, high intensity interval training, because it lowers mortality by 1/3. And I'm getting sugar out of my diet because sugar is inflammatory. It stimulates, both rages and ages, these advanced glycation end products that stimulate inflammation, right? I looked at all these inflammatory pathways in the MSIDS model. I went, all right, I'm going to clean out my metals. I detoxed myself and clean out from mold. And I'm going to take all these probiotics to make sure my microbiome is there. And I'm taking prebiotics with fiber to get those short chain fatty acid bacteria, making anti-inflammatory molecules. I worked this pathways right and left because I'm retiring from one-on-one clinical medicine after 41 years this year. And now I'm going to be doing consultations with other doctors. So
Okay.
patients around the world can now access me. If your doctor wants help with these things, you can contact me at medical@hvhac.com. Again, medical@hvhac.com stands for Hudson Valley Healing Arts Center. And I can work with your doctor if they need the help. And I'm planning on doing a randomized multi-center placebo NIH trial to prove Dapsone works. I got this new book coming out. I mean, I'm going to try and work from the one-on-one to now serving the millions. But
Yeah.
I am supporting my health, doing everything I'm telling patients to do,
Yeah.
getting to sleep now by 10 o'clock at the latest. I'm exercising daily. I'm doing everything I tell everyone else to do because I want to enjoy my lovely wife and, have a lovely, time together after working so hard for 41 years, but still finding a way to benefit humanity and benefit people. But as I said, work for the millions, and maybe RFK Jr. will contact me at some point along the way and we'll figure this
It,
piece out.
it could happen. It could happen. So, audience, I just want to, of all the supplements that Dr. Horowitz listed, the spirit behind them really is body through inflammation is trying to do good. Your body's trying to do good. It's trying to address what it thinks isn't working. And those supplements go to the end of telling, hey, body, what you're trying to do isn't actually working, and let's calm that down. So let's calm down that inflammation. And you're really speaking from that proactive perspective of we live in, for lack of better words, a very messy, toxic world. And the entire world is really stimulating and encouraging these inflammatory pathways, encouraging the body to go into overdrive. So you're almost balancing out this messy, toxic world by saying, here's some supplements that give equivalent signals to the body of, hey, don't go into overdrive. We got you. You're cool. Calm down.
Right.
Right?
No, that's exactly it. And I think, if we were not living in such a toxic world, you
Yeah.
probably would not need as many of these things, but you are exposed to these environmental disrupting chemicals, these hormone disruptors. You're exposed. I mean, most people know at this point with microplastics that you've got like the equivalent of a teaspoon, of plastic in your brain. I mean, a credit card, plastic, they describe it in different terms. I mean, the people who die of strokes at this point when they do endarterectomies and open them up, most of these people have huge amount of polyethylene, in there with microplastics that are driving the inflammation and the clots causing strokes and heart attacks. So I just this year I went to the cardiologist and had him do a Doppler and put me on a treadmill stress test, right? Not because I have anything. I just want to know,
Yeah.
has this worked? Have I plugged anything? It was all clear. So it's
Yeah.
like, all right, maybe the stuff I'm doing is working. But when you realize inflammation underlies every disease from heart attacks to strokes to cancer to ADHD to mood disorders, and you realize the 16 MSIDS factors are underlying inflammation with these 16 biochemical pathways that, by the way, intersect with all of these different MSIDS factors, it's like, okay, hold on. I want to make sure I get Lyme out of my body. I want to make sure I don't have long COVID. I want to make sure if I'm dealing with Epstein-Barr reactivation, I'm doing something. So you just can't leave these things alone, right? If you want to have a long, healthy life and have a good quality of life.
Yeah, yeah. And what I would offer, at least in my practice, especially as I've brought more and more functional genes in, functional genes can serve to the end of where do I invest my focus, my energy, and my effort? Because no two genes are ever, no genomes, people's genes are never going to be the same, but they can really speak to, like I look at mine and I was given an IOU instead of detox pathways. So I am that canary in the coal mine. If there's something going on in a room, I can tell you very quickly. But I know that that means most of my energies and efforts go towards a cleaner environment, as well as toning down responses to that sort of thing, right? An audience, I would offer something to consider is, especially if you feel a lot of this information is overwhelming, because I'm there, right? Sometimes it's a lot to be asked to do everything all at once. Sometimes it can be very helpful to peer into your blueprint, to peer into your genome, be like, cool, today the first thing I'm going to tackle is this, because this is where I'm weak at, and this might be that ocean of inflammation, that part of the ocean that means I'm going to be getting a mood disorder thing, or maybe a cardiovascular thing.
Yes. No, in fact, Dirk just put something up on there, which truthfully encapsulates everything. he says it better than I've even, I think, said it. He
Mm.
was saying you're converging on a unified theory of disease genocide, on the other coin, health creation, to arrive at an algorithmic protocol for diagnosing root cause from symptoms and guide treatment and resolution. Dirk, you said it better than I probably could have ever said it. I might want to put that in the book. It's so good.
Yeah,
I'm going to copy this and put this on a Word document. That was great.
absolutely.
Thank you for sharing that. So yes, that is absolutely what it is. And it's, it's exciting because we all want to live long, healthy lives. And, when you look at the stresses of just living in this world of what's going on, right, even just politically in the United States these days, I'm not going to go into it, but there's a lot of stresses that all of us are having these days. And that stress, when you're combining it, you're right, with your genetics, if you're not, you've got the wrong genes. You and I discussed this when we were doing the mitochondrial, and we're going to discuss this again further. But if you've got the wrong genes to be dealing with, how your norepinephrine uptake is happening, or how your serotonin uptake, you're not going to be dealing with these things quite as well, and you
Yeah.
need more nutritional support, right? So it's good to understand this, but I think yes, it's a unified theory that I'm hoping will, from my perspective, be a gift that I'm going to give to the world. That the gift of Lyme disease for me, what it did is, oh, it's not just I found answers for Lyme. Oh my God, I may have discovered, like, as Dirk was saying, like a unified theory of how to deal this with disease and also wellness, so we can live better on our lives, and integrate all of this, because we're exposed to so many infections and even the toxins affect your microbiome. You can't, even if you're not taking probiotics or fiber, all these toxins are throwing off the microbiome, even if you're trying to eat a healthy diet. So, it's almost impossible at this point not to be supplementing. Of course, what'll be great in the future is, have like the Framingham study they did with the nurses years ago. I'd like to see 50,000 people follow the advice. No, and in fact, I'm working with the University of California, Irvine. We're developing an app, by the way, next year. We'll hopefully release this, that will have the 16 points, not only how to diagnose and treat Lyme, but look at these other diseases. And people can sign up and go, well, I have these factors. This is what I'm doing. And every year you fill out a questionnaire. You look at your markers, you look at your inflammatory markers, you look at your health. Have you had a heart attack? Have you had a stroke? And we can follow people and go, well, this is the first time anyone's tried modulating all 16 factors for health and prevention. I mean, it needs to be done, right? And we're developing an app through some really cool researchers at the University of California, Irvine. Jonathan and Justin are working with me, and that's one of the projects for next year.
Yeah. Oh, I think, because I think that will go towards the end of being able to take, something like fibromyalgia, which was all in your head, to, well, here's a piece of paper with diagnostic criteria, and here's a set of labs that really confirms the biological presence. So we'll be able to take that sort of data and then shift some of these conditions and root cause into something that we can actually work with.
Yeah. Yeah, I mean, it's very hopeful for people, right? I
Mhm.
mean, because a lot of people, they go to the doctors, they lose hope. Like, I've been to all these doctors, they can't help me. All they're doing is giving me medicine for my symptoms. But
Yeah.
like, even in fibro, when I did the deep dive in the literature, I couldn't believe that the literature was showing me how many mold positive patients end up with, fibromyalgia symptoms. It's like, I didn't know that. They didn't teach me that 41 years when I got out of medical school.
Yeah.
And,
Yeah.
and I mean, we do our best to keep up, but who can keep up with all the literature unless you do this kind of a dive, right?
Yeah, absolutely, absolutely. And I mean, large language models eventually are going to be our friend and support this, but until that day, we have people like you who are doing that. I wonder, before we transition and maybe grab a few different questions and answers. So I've heard from a prevention perspective, you spoke very much on supplements, you spoke on exercise, you spoke on environmental medicine. Um, I wonder if briefly you can give a little bit of a discussion around some mind body medicine, because I think you're exceptionally qualified in this space to give voice to how important stress management is, and even beyond that, because I think stress management kind of gets us to, you're okay, how can we get even beyond that to a space where we're enjoying mind,
Yes.
that side of it, because we know that mind can influence inflammation.
Yeah, happy to. So, yeah, so I mean, the general pillars of health that everyone knows about, but I'm not sure everyone always does it, of course, is diet, exercise, and sleep. But when you go through the literature and you look at the number of adults with metabolic syndrome who have prediabetes, which is a precursor with high insulin levels, hyperinsulinemia, clogs up your arteries, causes dementia. It's associated with fatty liver. Fatty liver is now 1/3 of the world's population has fatty liver because you've all got PCBs and environmental toxins, right, causing all this fat accumulation. And what does fatty liver do? Metabolic syndrome, insulin resistance, and it can lead to cirrhosis and death. How many people, even if they have mild elevated liver functions, know to do this? So, yeah, so it's diet, exercise, sleep, right? Cleaning up the microbiome. But regarding stress reduction, and I think what's fascinating for what you do with the epigenetics, meditation, because I've been meditating now for, I mean, it's probably about 45 years. I started with transcendental meditation in Belgium in my first year of medical school. Went on to do the TM flying program, actually in the UK at the time, where they taught you levitation. That's a whole nother story I'm not going to go into today. Let's just say fascinating working with yogic principles of Patanjali from like thousands of years ago and what happens to your energy centers.
Yeah.
Stuff happens to your body, but it wasn't enough for me. I didn't find, for example, I was getting any more loving or compassionate, but it was great for getting through stress with med school. So I started working with the Tibetan Lamas. In the last couple of years, and I have some very, very, by the way, simple meditation techniques on the Medical Detective Substack. I did a 5-part meditation series, it might have been like 8 or 9 months ago, that encapsulates the essence of the Tibetan Buddhist teachings I've received. And again, when I'm done with the science book, my next big book will be this multi-volume set of these oral teachings I've received from these enlightened masters, whole nother story. But from an epigenetic standpoint, they found out, and there was a Nobel Prize winner in this, that when you meditate and you're lowering cortisol and you're lowering epinephrine and you're getting that vagal response to rest and digest in your body, it affects your epigenetics. It actually affects the telomeres on your chromosomes, right? So telomere shortening is what's basically aging us and killing us. You want to lengthen your telomeres, and that's what meditation does. So not only is it good to kind of get that orthosympathetic fight or flight response balanced with your parasympathetic rest and digest, and that's why in our practice, I recommend pretty much to almost everybody that they meditate. It can be 5 minutes 3 times per day. And again, you can find these very simple techniques on the Medical Detective Substack. But I tell them to do limbic retraining. Limbic and vagal retraining is essential. I mean, I had some forms of abuse when I was young. A lot of people come to me with physical, emotional, and sexual abuse. And the reason I think I've maybe been able to be more sensitive as a physician is because I had some emotional, physical abuse when I was young. Again, without going into details, I got through it. I think I became a stronger person from it. But I have a lot of compassion for what people go through with abuse. And so, you know, it makes me, I think, a little bit easier to have compassion for these people and understand what they went through. And including my wife, who she's gone through several different forms of this, you know, vagal retraining. We got her an Apollo Neuro to do. She's done the anti-hopper dynamic neural retraining. She's done the GEP to AIR, amygdala insular retraining, and now she's doing primal trust. I mean, so she's actually doing 3 of the major limbic retrainings. And honestly, when I have more time, I may even do some myself, because as much as we try and clear the trauma, many of us living on this planet right now have had some form of trauma. And that mind-body connection. So, you know, and psychological issues, by the way, is one of the 16 MSIDS factors, as is neurological symptoms. You cannot ignore that mind-body, you know, effect. And I initially learned meditation for stress reduction, but also because when I was young, I had a natural spiritual bent. I was speaking to God before people told me you can't do that. You know, I was listening and hearing things. I won't go into that one either. But I went to the Tibetans because I thought they were like the most reliable teachers I could get in some senses to teach me how do I recognize my mind nature to truly know, right, that what they'll call enlightenment or awakening. And truthfully, it's an easy process. You just got to do it regularly and practice the way you would do it anything. Their premise, by the way, which is great, is you don't get enlightened. You're already enlightened. You just forgot, because there's clouds in front of the sun, like your thoughts, your emotions, your feelings, by attaching to an ego, a thought of who you define yourself with. But once you go deeper at the bottom of the ocean of meditation, you see it's not dualistic perception. It goes beyond it. So yes, I think doing meditation and honestly vagal and limbic retraining to reset the neurosystem and get your psychological system apart from. I've spoken to therapists as I advise my patients to do. It's all been helpful, but you're bringing up a very important point. You cannot ignore it. I don't care how many supplements and things you do. You don't want to. And I've had patients, by the way, which surprised me when they got to the source of their trauma and they got beyond it. All of a sudden, the treatments that were not working all of a sudden magically started to work in these people. And it's like, oh my God, I can't believe it. And I've been doing medicine long enough to say, even I was shocked, the effect of that mind-body connection.
Yeah. Thank you for articulating that. So I think before I have two questions, I think an audience, again, I mentioned we wouldn't get to all questions, but we are saving them so they can inform our podcast. We will make sure that if you want to get notified of this podcast, don't hesitate to reach out to us, toss your email in the chat. Only we can see it, no one else will. And we'll make sure that you get emailed when this podcast comes out, which I think we're going to have to pivot a little bit more towards the inflammation side of things. But audience, I will offer, we talked a little bit around epigenetic testing, so I will plug our DNA aging test, which looks at how the wear and tear, if you will, of life on your DNA and how it is expressing. It's one of the ways that you can kind of assess your aging outside of just a calendar year. It goes a little bit beyond to say, this is how your DNA, how old your DNA effectively feels, how old it is presenting. Yeah. So,
by the way, I was just curious. Some of the recent articles I've been reading about with epigenetics is that the aging happens in different levels in the body, like your heart and your liver can age at a different rate than other, organs in the body.
yeah.
Can you speak to that a little? Because I read it in the literature recently. Can you talk to me a little bit about it? Does the testing tell you that, or it's just giving you the genic?
Yeah, so the testing will look at it through two different perspectives. So the first perspective is quite literally going in and assessing how old does the body feel, or how old does the body think it is compared to your calendar age. And so really you're looking at that rate of aging. And if you're aging at 1 year per year, really you're just clocking the same. Anything over that, unfortunately, that is a significant increase of mortality, because the body is under undue stress from your perspective, and a very valid one is from inflammation, right? Body can't manage all of that, so it is coming closer, and this will be from any cause. If you're less than that, it means the pressures on the body, the pressures on your DNA are not as marked, and so your body actually thinks it's aging less than that calendar year. And so those are the people that kind of, defy what you expect, the 80-year-old that looks and acts 60, right? Now, more specific to organ systems, and I think this is really interesting. So there's certain points within the genome that this test will focus on, and we know those as islands, if you will, and it will really measure the amount of methylation there. And different islands will be associated with different health outcomes. So sometimes they'll look at more cardiovascular outcomes, sometimes they might look at renal or kidney outcomes, sometimes they'll look at brain, or general, they do look at immune and inflammation. And so it's really saying, is that section of the DNA that's really closely associated and studied to this or that, is that being worked? Is that being turned on or off? Whatever that methylation acetylation pattern might be, unduly in a very stressed out way. And so that can really speak to, especially when we think of this ocean of inflammation, this is, the test might be able to say, it is truly your cardiovascular system that is bearing the brunt of this, as opposed to maybe your digestive, or as opposed to a general immune picture that the body is seeing. So that one thing I really like about the test is it's another way to peer into where is body receiving stress, especially before you truly do see it, right? Because cardiovascular, better or worse, oftentimes we only really see that when the person shows up with a heart attack, right?
Right. Right. So I might look at hypertension and high cholesterol and metabolic syndrome, diabetes. I'll look at all the major known risk factors for this. But you're saying, even if I think I've got the hemoglobin A1C at, 5.4 and the cholesterol looks good and the blood pressure is controlled, there's still a possibility, right, from your perspective, that we'll see these methylation problems with the heart, and we say, hey, we may want to do more mitochondrial regeneration, right, for the heart in this case, and otherwise we wouldn't have considered it.
Yeah. Exactly. I think it shifted. I think the good analogy that I use to kind of get my headspace there is I used to think of HbA1c, an audience that's a marker for blood sugars that tells us, over the past 3 or 4 months, have you been pushing your blood sugars too hard? Are you kind of approaching that diabetic? Are you in that diabetic space? I used to think of that as a warning signal, and I now think of that as one of the last flags of the body, right? That's one of the last things that the body will shout out through blood work, that it takes years to get to that point. And this epigenetic testing is able to peer into those years that it takes to get to the point, because the body's very resourceful. The body wants to be alive. It's doing all it can to kind of control what's going on. And so we don't always have great insight into what is it doing to try and control, and the stress it's undergoing to control what's going on.
Yeah, that was great. Yes, thank you, Chris. By the way, just one quick answer to one of the questions I saw. If you have leaky gut, it's not that the supplements won't work, but assuming you don't have alpha gal or a problem with bovine immunoglobulins, and because I have leaky gut, I've been on bovine immunoglobulins with, mega IgG and megaspore and probiotics, and previously used to use Zymergen's product OptiCleanse GHI for gastrohepatic intestinal. You can still work on your gut and heal the leaky gut and get the microbiome in order. It doesn't mean the supplements won't work, but it does mean you need to work on the leaky gut and do your best with your diet and make sure mast cell activation is not happening at the same point. I saw that pop up, and I just wanted to make sure she knew.
Yeah, no, thank you for that, because I'm always hesitant, especially when I see leaky gut, of like, how many supplements am I going to give? How wasted are they? So thank you for that. Yeah. So I'm just going to arbitrarily pick 2 questions from our question pool. I saw quite a few around chronic kidney disease. So this ask of, does inflammation influence this? And does resolving inflammation kind of lessen the burden, lessen the risk factor, especially more progressive and deleterious disease outcomes?
Mm-hmm. I mean, most of the kidney disease I see in my practice, and thank God I really don't see that much. Most of it is from people with metabolic syndrome, uncontrolled diabetes, metabolic syndrome, and hypertension. With things like renal artery stenosis and inflammation. I mean, we're not dealing with like there's a mitochondrial disease called Fanconi syndrome, for example, where you start losing amino acids because the mitochondria in the kidneys aren't working properly. But there's a new kidney disease I should tell you about, though, mesothelial nephropathy, which is basically a heat stress kidney disease. It's actually a good point you brought this up, because I don't see a lot of, I have a good friend of mine, he's turning 90, and his kidney function has gone up, but he goes to the nephrologist, and, they're looking at him going, oh my God, you're in great shape for 90 years old otherwise. But every year as you get older, the amount of nephrons in your kidneys goes down. But if you're protecting against inflammation, yes, but it's not just protecting against inflammation, it's protecting against elevations in blood pressure and elevations in blood sugar, things that are known risk factors for kidney disease, right? But this new one about heat stress, they found in the workers in the fields that were out there for a long period of time who weren't hydrating, they're getting chronic kidney disease early in life. And it's basically a new kidney disease. It's only been basically found out in the last 1 to 2 years. And it's basically from heat stress on the kidneys. And it's only been seen with the changes in climate that we're now starting to see. So that's something to keep in mind, because heat stress, heat stroke, I mean, these are things we all have to be careful with, because we're seeing more wildfires and, heat than we've seen before. Be very careful hydrating to make sure, right, and staying inside in the really hot weather, just to make sure that you are protecting yourself.
So if I heard you correctly, be concerned about heat, but there's an element of proper hydration can balance that if you're exposed to prolonged heat.
Yes, that's correct.
Okay. The very next arbitrary question is, I saw a few questions around parasites. So when you were mentioning all the rivers of inflammation, you mentioned bacterial, you mentioned viral, you mentioned fungal. Does parasites tuck into that as well?
Yeah. Well, so the major parasite that we see a lot is Babesia. And in the main Babesia parasite I started with in the US, I was the first doctor to recognize it in the Hudson Valley, is Babesia microti. Then came Babesia duncani from the West Coast, which looks like it's spread. And in Canada, where you are, there's a new kid on the block that looks like it's now in the US called Babesia oticolii. So these 3 forms of parasites, they're malarial type parasites. So anyone listening who says, I have unexplained day sweats, night sweats, shaking chills, air hunger, I can't seem to catch my breath and I don't know why. I have an unexplained cough or even low grade or high grade fevers. Those are classic symptoms of Babesia. while making fatigue and headaches and joint pain and muscle pain and neuropsychiatric symptoms worse. In my practice, that's the most common. But what's interesting about this parasite is it interferes with your immune system getting rid of other parasites. So if you were to do, for example, a GI map or a comprehensive digestive stool analysis, and you find Giardia or amoeba or hookworms or whipworms or all these other parasites, it turns out that your immune system doesn't clear them as efficiently because of the way Babesia affects your innate and your immune system. So that's the most common parasite I see, which I think probably is the most common one most people would be exposed to. But obviously, depending if you're camping or in different countries, Giardia and amoeba and some of the other ones are still out there. But we certainly don't see those as much. But if you do ever have a resistant parasitic infection in your gut, and you can't seem to clear it with some of the standard drugs like mebendazole and ivermectin and the usual ones that are used, I would say to you, look to see if you've got Babesia as an underlying parasite. It's extremely common. The ticks now, when they transmit Lyme in the body, and the last study from BMG Global Health was 14.5% of the global population, or 1 out of 7 people on the planet, has now been exposed to Lyme. What they showed is when the ticks inject Borrelia burgdorferi Lyme in your body, Babesia is most of the time in these ticks, it comes right behind. So you're getting Lyme and Babesia almost at the same time. Bart, we're not sure about tick, if it's tick transmitted. There was a species in Europe, Ixodes ricinus, that does, but I think most people have been exposed to cats or fleas or mites or all these other mosquitoes, spiders. I mean, it's being transmitted by lots of vectors. But yeah, from a parasitic perspective, I would say those symptoms I said with Babesia, and if you think you might have it, do an immunoblot, an IgG immunoblot from Igenix Laboratories, and a Babesia fish, fluorescent in situ hybridization. It's an RNA test where you can see the Babesia under the microscope fluoresce green. Because immune systems have been adversely affected by toxins and infections, not everybody makes antibodies against Babesia. So you could actually have it and you won't find it on antibodies. You've actually got to do an RNA fish test. Both Igenex and T labs, excellent labs for picking it up if the symptoms I was just describing sounds like you may have it.
Dr. Horowitz, thank you so very much. This was a wonderful marathon of an hour, but I'm grateful that you're able to share, and I'm grateful that we get to continue this conversation in a few weeks from now. So audience, thank you so very much for joining us. Thank you for being part of this learning and part of this conversation. You inspired some really good thoughts, and these thoughts will continue and carry over to the podcast that we host. Again, if we don't have your email, please toss it into the chat. Only my side of the team can see it. It's not everyone won't be seeing it, and we'll ensure that you get notified of that. Dr. Horowitz, again, thank you so very much for the offering that you are giving to the audience and to the world by transitioning your practice and all this investigation that you've done into truly what is inflammation and how can it be this, to quote Dirk, this unified theory of wellness.
Yes.
Yeah.
Yes. Thank you, Krista. It's always a pleasure speaking to you. I enjoy our conversations. I think it's a great back and forth, and I think people get a lot out of it. So thank you for doing it.
Yeah, no, of course. Well, I'm looking forward to 2 weeks from now. And until then, audience, we are so grateful for you. We're here tomorrow night as well. We're going to be talking about caregiving. And so those who are caregivers, if you want to join in, we're going to have that really honest conversation about the reality of your world and how you can support yourself, especially knowing your genes, because that will influence things. Until that time, au revoir, mes amis. Au revoir et merci.
Au revoir tout le monde.
Au revoir.